James Longman joins us now from Milan. Several towns in northern Italy locked down, but unlike Asia, Europe has open borders. We've already heard about that new case in Spain, a traveler from Italy testing positive there, a hotel lockdown. Can travel restrictions even work in Europe?
Well, that's a brilliant question, Lindsay, and that's exactly what health officials were talking about today. Remember, Italy borders 6 other countries, so a lot of European countries really worried about the spread. The focus here in Italy is on these 12 towns, about 30 miles from where I am now. Real effort to try to lock down the virus there, but it hasn't worked because it's got out. It's an invisible enemy, and it's traveling. So Croatia, we know that there's a case there linked to this part of northern Italy. Switzerland as well, as a number of other countries like I said, Spain as well. There's on the mainland there, Barcelona, we know that there's a case, but also on the Canary Islands, there's a hotel there that an Italian doctor visited, then tested positive for the virus, is now gone into quarantine. But 1,000 guests are at that hotel. They've all been told they've got a lockdown in that building. Their little notes were passed underneath each of their doors to tell them to stay in their rooms and wait to be tested. So you can just see how this kind of kernel of infection here in Italy can spread so quickly. These health officials today said it wasn't helpful to talk about closing borders. You can just imagine the level of panic that would send people into, I think, across Europe if people did decide to do that. But it's a really difficult thing to stop the spread of, because like I said, it is an invisible enemy. Certain parts of Italy are taking other precautions. We now know in the last few hours we've heard from Syracuse University in the United States. It has a study abroad program here. About over 300 US students in Florence are now going to be heading back to the United States because they're worried. The contagion does seem quite powerful. So because of the kind of total unpredictability, if you like, of this illness, I think it's left a lot of people on edge and just not sure kind of how to go about their daily lives. But yeah, this question of this kind of illness spreading around Europe, it's a big one right now. Yeah, I can imagine. And we've certainly seen images of stores being cleared out. How concerned do you see people with that palpable panic that we've seen similar images of in China? I think the people who are really panicked are staying home. And I think what we've seen here in Milan is a city which is much, much quieter than it should be. Schools, libraries, universities, authorities are locking down these public spaces, saying stay away from these places. It's a really difficult thing to try to manage because there's no cure for it. So all you can do is say to people, stay away. We've heard that a lot of supermarkets, especially inside that zone that has been blocked off, the shelves have been cleared from there. But I think a lot of people are kind of taking it in their stride, not really sure quite how to kind of manage the risk. Some people say they should wear a mask because, you know, it makes them feel safer, but actually the kind of medical, whether that's appropriate medically, I think is questionable. We've seen other countries kind of take other measures. So for example, in the United Kingdom, they're asking people to take themselves off into kind of self-imposed quarantine. So the government is not telling people to stay at home, but they're forcing them to, but they're asking if they could, they should. There are certain schools that have now said to their pupils to stay away. Last week in Europe was half term. It was a holiday for a lot of school children across Europe. So you can just imagine the amount of travel that there's been over the last sort of 10 days or so. And in the United Kingdom now, schools are saying to any kids who went on holiday skiing, perhaps in Italy, stay home, we don't want you at school. So a lot of ways to try to manage this, but no one quite sure exactly the right way to do it. And James, we're just learning as we're talking to you right now, there's actually 2 confirmed cases in Spain, in that location, that resort town, the Italian doctor and his wife. So, of course, these numbers just continue to update all the time. But, James, thank you so much for that report in Italy for us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.